Signing up for Medicare can be confusing, it can be overwhelming, and it can just be downright frustrating. And that's why today I'm meeting with Brian Ritter and Steven Jackson from Wisdom Insurance Network, and they're going to explain to us how they help seniors to sign up for their Medicare and make the right decisions and hopefully not make any mistakes. So thanks so much for joining us today.
Thank you.
Tell me a little bit about how you guys got started into this business.
So Wisdom Insurance Network was formed in 2024. We're located out of Knoxville, Tennessee. We now have an office in Hardin Valley, which we're shooting this at. Steven started his journey in Medicare about, 4 years ago now? And same with me. He was more on the recruiting side of things, whereas I jumped into the sales call center route, learned Medicare like the back of our hands, and have now helped agents across the country, people across the country sign up for Medicare. And being brokers, having access to all the carriers really provides us a way to be an advisor to them, help them understand what they're enrolling into, help them understand what you've paid your whole life for, and then make an educated decision, have them make the educated decision to pick the plan that makes the most sense for them based on their medications, doctors, income, lifestyle, things like that.
Right. For someone turning 65, what is the very first step that they should take when it comes to enrolling for their Medicare?
Yeah, education is always what we say you should start with. Education first. So, 3 months before you turn 65, that is when you actually get to start making your decisions, whether they need to go Medicare Advantage or Medicare Supplement. So not even educating yourself just on the products available, but on your timeline as well. Because you not picking the right plan at the right time could lead to a penalty, and that penalty sticks with you for life. So education, I would say even 6 months before you turn 65, I would start looking at resources, calling agents, and figuring out, at least get a game plan put in place. Even if you're not going to retire at 65, you may still want to go on Medicare. So we always start with an education first approach, and that's what we recommend.
And that's really smart too, because I know you guys are getting ready to come into your busy time, so it's going to be a little bit more difficult to focus and give someone that full attention and that full education that they're going to need, right? Because it's a lot that they have to really take into consideration.
Oh yeah, for sure. Absolutely. I mean, there's so many variable factors, and then you take into consideration that Medicare changes every year. Yes, it's a lot.
What are some of the biggest mistakes that people make when they sign up on their own?
Ooh, that's a tough one. There's a laundry list of them, but biggest one, since Steven touched on it, was the penalties. There's two different kinds of penalties. There's a prescription plan penalty, so if you don't select the prescription plan at 65, you're penalized 1% of every month that you do not have one. And like Steven said, that is a lifetime penalty. There's also one for Part B as in boy, that's the doctor's outpatient kind of stuff, and that is 10% of every 12 months you do not have it. So 10% of $185, you can do the math on that, folks.
Right.
Those are two big ones. If you're penalized those, getting rid of them is near impossible. Dealing with Social Security, figuring that out, it's not going to be an easy road. So make the right decision, find a local agent, find someone you trust, and trust them. They're the expert. Don't try and read the Medicare and You book. Don't try and call 5 different call centers, because they're going to sell you what their spiff is that month, whatever carrier is giving them the most money. Whereas someone local, they're going to treat you like family. You're going to be able to go to their office, ask them questions when things arise.
Well, it's all about community, right?
Yeah.
It's about, these are people that you're going to have to maybe see out in the community face to face one time, and you want to know that there's that integrity behind.
Exactly. We treat everyone like family, and I always say, if you were my family, this is what I would put you in, because based on the XYZ, medications, doctors, income, lifestyle, what's most important to you, we're able to navigate all the plans, and I like to say the mess they created to find you what you need.
Yeah. Because I wish I would have known you guys a year ago when my mom was signing up, because watching her go through all of that, which she's going to be giving you guys a call. But yeah, I mean, it's kind of like trying to read the IRS tax code, right?
Exactly. and don't try and do it. Like I said, the Medicare and You book is, I feel like it's meant to confuse you.
Yeah.
At 65, you have an open enrollment period, no health underwriting. You're able to go into any plan you want. So that's the most important time. The people that wait to 75, 76, 77 to learn what Medicare is, it's too late.
So can you share a success story about someone that you helped?
Yeah, I mean, several. We talk about, like, we haven't even touched on Medicaid yet, but if you have a low income person that is on Medicaid and Medicare, they are eligible for a dual, it's called a dual special needs plan. Dual meaning you have Medicaid and Medicare. Some cases we meet these people, they are not currently on a Medicaid plan. So I know Ryan's done this several times, I've done it several times. We will actually help them apply for Medicaid. We don't promise them any level. It's up to the state to decide the level, but we help them apply for it. And in most cases, we're giving them like $200 a month for groceries or utility bill assistance. It really can be life-changing. I've had that happen several times, and those are the best stories because, you know, you're truly making a difference in their life every day.
And that's, you know, and you're just helping them to help them. It's not like you're getting anything out of that. It's just, you know that there's a benefit out there that can help them. And so that's awesome that you guys do that. That is.
I do have one. I met a lady at a flea market. This story reminded me of it. It was a daughter. She came up to the booth and was just asking, my mom's been trying to figure this out for years. We had her on full Medicaid within 2 weeks and a dual plan within a month and a half. So she not only had all of her medical bills paid for in full, which again, we don't get paid for to sign up for Medicaid. That's just a resource and an advisor giving them everything they're entitled to, but it gave her health insurance, which she didn't have. It gave her $290 in a food card that she didn't have, $5,000 in dental, $600 in vision, all at $0 cost to her.
That is life-changing.
So it is life-changing, and that's why I do what I do.
Okay.
We do what we do.
So let's get down to the cost. What does it cost somebody out of pocket to have you help them with this?
Absolutely nothing. All you need to do is just call us, set an appointment. We are paid by the insurance companies if you enroll. And I've told more people that they are on the best plan this year than actually enrolled people, because changing someone's plan when they don't need to be changed is only going to lead to issues down the line. So if you don't know, you have any hesitation on a plan, it is no cost to you to call us. Take an hour out of your day. We'll take an hour out of our day to plug in all your medications, doctors, income, lifestyle choices, and find the best opportunity for you with all the plans out there. So
now, I don't know about anybody else, but that sounds pretty amazing to me. So what's one piece of advice that you would give to anyone that's approaching Medicare right now?
Find a local trusted broker, even if it's not us, and, you know, vet them, make sure they know what they're talking about, but then trust them with your insurance needs, from the education to plan selection. We have to do a lot of certifications every year. AHIP, every carrier like Humana, Blue Cross, we have to do another certification for them. It comes out to about 40 hours a week or a year of CE just to be able to sell these products. So find a local broker, have them educate you, have them check your drugs and your doctors, because that's the most important things on these plans. And just, you know, trust them with your insurance, because we do a lot of certifications and training to make sure that we know what we're talking about to help them.
So, I mean, you kind of touched on it, but what do you enjoy most about working in this field?
Taking someone that has absolutely no clue what Medicare is, explaining it, and asking them at the end, do you have any questions? And they say no. It is so rewarding to take someone from completely lost to knowing every benefit of their plan.
You see that light bulb and they're like, oh, okay, like, you know, I get it.
And we take it a step further too. We don't just enroll them in the plan. We become your customer service agent for life. I always say you can call the number on the back of the card and get someone offshore, or you can call us locally in your backyard and get a new ID card, answer a question, anything you need.
That's the benefit to working with you guys, is it's the same person every time, and you have a deep knowledge and an insight into exactly what their thing is, instead of, you know, when you just call the number, it's a different person, it's a different, you know, go around. So, you know, how long you have to be on the phone with that person and get transferred to another and to another.
And that's, well, you got to wait on hold too first. So that's 30 minutes to an hour with most carriers. And then, like you said, then you get a rep that you have to explain your whole life to. I know most of these people's kids' names, dog names, what they do for hobbies. If you trust me, that's the least I can do, is learn a little bit about you and help you navigate the insurance maze.
Yeah. And that's so powerful, because it is such a big deal, especially when you're getting to an age where you're going to be visiting doctors more often, unfortunately. Bodies break down.
It happens with age. And we do take it a step further after enrollment to help them find doctors that take their plan, help them find dentists, help them find hearing aid places, eyeglass places, anything that is a benefit on the plan. We try and form partnerships in the community to support local businesses and connect our members with the proper resources. Because otherwise,
I've seen you guys actually do that, actually network with other people and connect your customers with another provider or another business that can help them. So that's truly the meaning of community.
Yeah, most of these plans have benefits that are at no cost to them. It's just a matter of them knowing they have it and then going and using it.
Yeah. So how often should someone review their Medicare?
Yeah, great question. The annual enrollment period, which is October, it begins October 1st. Enrollments can't begin until the 15th, but that is when the plans change every year. So you will be able to preview the 2026 plans October 1st.
Okay.
So that is when we like to tell everybody that's the time to review. You will get a ANOC letter, which stands for Annual Notice of Change. Mm-hmm. And that basically says, here's your current plan this year. Here's what it's going to look like next year. And that ANOC is a very good baseline to go off of to see, do I need to see an agent this year? One, because that's your current plan and that's what it's going to be. And two, it just gives you an idea of, I can review this on my own, then I can meet with Steven or Ryan and they can tell me, is there anything better? So yes, annual enrollment period every year. I would definitely review that regardless of if you're on a supplement or an advantage plan, because the supplement, you have a drug plan, hopefully. And if you, that's going to change too. And especially this year with the rising costs of supplements, definitely want to review that because every penny counts and the prices are going up.
Yeah. Do you ever have like kind of a preview of what the new plans are going to be? Like, do you ever have like, I don't want to say inside information, but kind of.
Yeah. Ryan and I have seen all the plans for 2026.
Okay.
We started seeing them about 3-4 weeks ago.
Uh-huh.
So we already know what's happening, but we cannot share it till October 1st.
Since you have relationships with your customers,
Mm-hmm.
you kind of already know
Absolutely.
what's going to work for them. So it's not going to be a big delay, like this big study session of, oh gosh, what do I need to do now? You kind of already have a handle on that.
Absolutely, because when we do our appointments, we collect your drug list and your doctors, and that stays in our CRM. So next time we're just reviewing, have you added anything? Have you came off any drugs? Have you added a doctor? So yes, we have a system for that.
Perfect. So, the time's coming up. If you need to have your Medicare reviewed, which it's highly recommendable, even if you've had it looked at last year, give Steven and Ryan a call. They will be happy to go over it with you, let you know if you need some changes made, let you know if you're okay where you're at, and it's not going to cost you anything out of pocket. Give them a call. They'll take great care of you. Thank you so much for joining me.
This was awesome. Thank you.
Awesome.